All right. Well, I want to welcome everyone to our Obamacare Made Easy for Employers webinar. My goal is to keep this in 30 minutes or less because I know everyone is busy. My name is Greg Downing, and the purpose of this webinar is to show you the simplest, easiest, most cost-effective way to offer benefits under the Affordable Care Act. Now, if you're like me, most of the information that I'm able to get about Obamacare is very political, whether it's from the left or from the right, and a lot of it is filled with half-truths, which doesn't help me as a small business owner figure out what I'm supposed to do. So I've had to spend thousands of dollars and probably logged over 1,500 hours trying to figure all this out. And I'm going to try to give it to you in about 30 minutes. So here we go. Now, one of the things that at least we can all agree on is that health insurance is extremely expensive. And that's why we're in this situation. So most employees or most individuals or most Americans, however you want to call it, get their health insurance through their employer. And most people believe that getting your health insurance through a group plan from an employer is better. Now, I'm probably going to change your mind about that by the end of this presentation. One of the problems that we have is that 60% of small employers don't even offer health insurance, and every year less and less employers can afford to offer health insurance, which leads to the problem that we have millions of Americans that don't have health insurance or access to affordable health insurance on the individual market. And of course, we shall not forget about all of the uninsured children as well. Now, who is to blame for this? Now, the government and a lot of people want to say, well, the reason we're in this mess is because, the health insurance companies, they're raping us. They're charging too much money. Well, health insurance premiums are simply a symptom of the problem. It's because health care is expensive. If 1 in 4 Americans doesn't have health insurance or a way to pay for health care, that means that every 4th person that walks into the emergency room can't pay. So what happens? Well, they have to charge more for the other 3 people that can pay. And that's just one of the problems, and I could go on and on about why healthcare is expensive. But nonetheless, the government says, okay, we've got to do something about this. So here's what they have come up with to take care of that. Now, I know probably the first thing when you see this, you say, hey, where's Waldo? Actually, he's right over there. I found him pretty quick. All right, so I know this picture's not real clear. Even if it was clear, it probably would not be clear. But think about this. So who's in charge of this is the Secretary of Health and Human Services. And everyone answers to Kathleen Sebelius through this process. So here we are, if you're a patient, and somehow you're supposed to navigate through this and end up over here at the doctor's office, and this all makes healthcare less expensive. We will see. Now, the bill, it's twice as long as the Bible. Unlike the Bible, no one's read it. It doesn't appear. And you take in another 20,000 pages of rules, regulations, guidelines. It is a monstrosity. So what happens to most of us is we don't understand it. I mean, most people don't even read their health insurance policy, much less something like this. And so there's a lot of confusion, lack of knowledge about what's supposed to happen. The only thing that most people know is that if you don't buy health insurance, there is a tax. Now, the tax is real simple. It's 1% of one's annual income. So if I'm a single person, I make $30,000 a year, I decide I don't want to buy health insurance, I'm going to get hit with a $300 tax that will be due 2015 on April 15th. So if you take $300 and you divide that by 12 months, it's basically a $25 tax every month, which probably is not enough to motivate someone to buy health insurance unless they can get health insurance for a very reasonable cost. Now, the taxes is just, it's not that big of a deal, but it is an irritant. Now, this is the game changer. This is going to change the way small businesses, small employers provide health insurance from here on out. Now, the state exchanges are real simple. The concept was every state would put together their little marketplace and invite in certain health insurance companies, and then people could go pick the plans they wanted, compare side by side, and which that exists today. This is not a new concept. You can do that all over the place. But the difference is in the state exchanges, that is where the government is going to subsidize most of the cost of the insurance premiums. Now, they have had some problems with the state exchanges. One, you'll see the word marketplace there. You'll see that exchange doesn't translate to anything in Spanish. So we've got millions and millions of uninsured Americans that their primary language is Spanish that will be eligible for these subsidies. So they said that's not working. Plus, exchanges, the term confuses people. Marketplace, a little more friendly, a little more descriptive. So they're the same, but the government now calls them the health insurance marketplace. Another issue that came up with is that half the states, including Texas, said we're not going to do this. So Texas and many other states simply have defaulted to what the federal government exchange will look like. And of course, those begin where folks can enroll in those October the 1st of 2013. So the question is, who qualifies for subsidies and who will be going to these exchanges? Well, here's the main two criteria. Number one, your household income, your household does not have access to affordable health insurance, and that means normally through your employer. And your spouse, if you're married, neither one of you have access to affordable health coverage. Number two, your household income is between 100% and 400% of the poverty level. Now, if you're like me, I didn't know what that meant. So, what does that mean? Well, here's a chart. Now, this chart is the 2013 Federal Poverty Level Guide, and it shows what's considered to be at poverty, and obviously it's based upon the number of individuals that live in your household. So it's pretty simple here. If I'm a single person, I can make up to $45,960 and still qualify for subsidies under the Affordable Care Act. And look at a family of four. They can make up to $94,200 and still qualify for government subsidies to buy health insurance. So just think real quick about your base of employees and how many of those might fall into this category. Now, for the people that qualify, how much do they have to pay? Well, this is the thing that no one really gets, is that it's limited to a percent of that individual or that household's income. So for instance, if I make 100% of the poverty level, I would only have to pay 2% of my household income towards health insurance premiums, and the government would pick up the rest. And then it gradually creeps up to a maximum of 9.5% for the folks that make right at 400% of the poverty level. Now, to put this in perspective, let's say that I make $29,000 a year and I have a wife and a kid. So, according to the chart, it shows that that income with that many people in my household, I'm at 150% of the poverty level. So, I only have to pay 4%, because that's where I'd fall in, 4% of my income to buy health insurance. And if you do the math on that, that ends up being $96 a month that I would have to pay to get really good coverage for my whole family. Now, let me just let you know that we are recording this. I'm going through a lot of stuff quickly just to get the point across. So you can go back and I'll make this accessible, or you can watch this again. So we, thinking about this, sorry, it kind of fries my brain. I don't know if that makes sense. Some of you have made comments that this is crazy, and I asked, did it make sense? And some people say, no, it doesn't make sense. Well, that's the way the program works. And if you think about this, we estimate that roughly close to 70% of the population makes less than 400% of the poverty level. Because you take Texas, our average household income is right at $48,000. So there's lots of people that can qualify for these subsidies unless you have access to affordable health care. And a reminder that if you have less than 50 full-time employees or full-time equivalents, you are not required to provide insurance. And if you do continue to provide a group plan, group insurance, you better get ready for about a 20 to 40% hickey on your renewal in 2014. That's what they tell us are coming. And I've seen them, and I believe them. So in addition to continuing to provide group health insurance, you'll have to do the W-2 reporting. You'll have to do all the continually reconciliation and all the other HIPAA, COBRA, all the other things that go with that. And you're going to have to make sure that the health insurance you provide meets the essential benefits rule and the actuarial value of 60% or more. I'm not going to get into that. I don't even want to talk about that. So those are things to think about. So here's my old school belief, which many people believe, is that group health care is better. Now, today, or go back in time, that would probably be fairly accurate, because let me just give an example. So let's play like this is me. Let's say I'm looking for a job and I got a wife and 2 kids. So before all this came about, it's important because my wife's got a medical condition and I believe she may be pregnant, so I need group health insurance. I just got to have it. So I've had 2 job offers. One is from employer A. Employer A has offered me $55,000 of salary, plus he's going to pay $5,400 worth towards my group, to my health insurance. So that makes me feel good because I know that pre-existing conditions will be covered, and if my wife is pregnant, I can get maternity coverage for her, and whatever I have to pay for my health insurance for family coverage, I can pay pre-tax to the Section 125 and get covered. Now, employer B, who I really want to work for, doesn't have group health insurance. So he said, well, hey, look, here's what I'll do. I'll bump up your salary to I'll give you I'll put that $5,400 in salary so that your compensation would be the same as employer A. So you're both at $6,000. I mean, both of us are offering you $60,400 in total compensation. So I'll go back to the house and I'll contemplate on that, and then I'll go over to employer B because that's where I want to go first. And I'll look at, okay, so that's my taxable income. Let me just kind of point this out, going a little fast here. That's my taxable income. Now, you'll notice that this number right here, that is the cost of health insurance in 2012 for family coverage. That's the annual cost for health insurance, 14,556 smackers. So it's a lot of money. Now, I would have to pay for that all by myself, and I'd have to pay for it with after-tax dollars under employer B, plus I've got a higher tax load, and so you can see my net income. Well, then I go back over here to employer A, who doesn't really have the haircut I'm looking for, but nonetheless, some advantages. You'll see my taxable income is less. That's because I have a lower salary, and everything that I spend on benefits is done pre-tax. So you do the math on that, blah, blah, blah. It's about $2,000 more in net take-home to me. And in addition to that, employer A saves about $1,100 in payroll taxes because he's paying that on a smaller amount. So when I look at this as a prospective employee, then all those things that have been told to us is you provide benefits, you'll attract and you'll retain better employees. That's actually true in this scenario. So even though I probably would have gone to employer B, but because I need to take care and do what's right, I'll probably go to work for employer A, especially if all I'm worried about is my financial benefit. But things changed dramatically post Obamacare. So we're now in 2014, and it's all different. All right, so we know what employer A is offering. So let's see what employer B's offer looks like this go around. Same salary, cool office, cool company, and in addition to that, I could possibly qualify for the subsidies to help pay for my health insurance. And in 2014, all individual plans are guaranteed issue. They have to cover all pre-existing conditions, and I can get maternity and things like mental illness coverage that I couldn't get before in an individual market. So I'm kind of excited. So I go back and crunch the numbers. We know what employer A offers. Let's go to employer B. All right, so same scenario, same income, no contribution. Whoa! Look at this number though. Good gosh almighty, 9,580 smackers. That's a lot of money. Now, the important thing to look at though is now where does that money come from? Well, the important thing to look at here is right here is what I have to contribute as an employee. So this amount of payroll puts me at about 250% of the poverty level. So what that means is, according to the chart, I only have to pay a little over 8% of my household income to buy health insurance, and the government picks up the rest. So as you can see in this example, I mean, that's almost $7,400 more take-home pay that I would receive from an employer who doesn't provide health insurance. Now, poor employer A, he's doing everything he was taught. He's trying to do the right thing because he's moral, he's ethical, he's following the procedure. But as the employee, that serves no benefit for me. Now, just to show a little point here, the thing that's so interesting about this is that since my cost is capped, it doesn't matter if this is $20,000, $50,000, I'm only going to pay this amount. The government's going to pick up the rest. Over here, either the employer or myself have to figure out how to pay for all this. So just note that it doesn't matter how much the health insurance costs. I only have to worry about what my percentage is that I'm responsible for. Now, I know this is a little odd, but that's the way it is. So as an employer, I'm going, well, what is the benefit of providing health insurance if many times I'm actually going to penalize my employees? Plus, I hate having to deal with health insurance anyway. I hate renewals. Everybody complains and gripes. Surely there's got to be a better way to do this, and this opens the door for that. Now, I'm going to ask you this question because a lot of people didn't know that you could do this. Did you know that you could have individual policies be paid for pre-tax by your employees? Does anybody know that? Larry said, no, I didn't know you could do that. Okay. Did you know that you can give your employees a pre-tax allowance for health care costs, and they can use it to pay for health insurance or deductibles or co-pays, dental, vision? Did you know you could do that? Bill says, I thought that was illegal. Well, no, that may be what your health insurance agent told you, but that's not actually true. So these are things that are available out there, but most employers don't know about them. Now, my whole thing here is, well, if the government is going to subsidize up to 70% of my employees, why not let them? Why not? I mean, I can't compete. I can't compete with $9,000 subsidies to pay for family coverage. There's just no way. So if the government wants to do it, let them do it. We believe, and I say I believe, and most people that are in the industry believe that one of the best solutions is to use a private individual health exchange for your employees to go get insurance. Now, we've always been thinking of a group plan, having them on a group policy, but now the government has clearly showed us that we're headed to an individual responsibility of buying insurance, taking care of that. And so this simply facilitates that. So an individual exchange, and it allows them, your employees, they can access both subsidized plans from the public exchange, and if they don't qualify, well, then they can get unsubsidized health insurance on their own, and maybe you might want to help contribute to some of those costs. And they can be other products as well. Now, this is an example of what it would look like, is that what we have and do for folks is set up simply an exchange where individuals can go click on that, and you'll see there's a toll-free number. You'll see that they're open from 8 a.m. to 8 p.m. And if an employee has a question about health insurance, they can call that number. You can customize this to where they can answer the phone. Your company name can be up there. Or you can use one like ours or someone else's where they can access this information. If they want to buy dental, vision, it's up to them. And if you decide, well, hey, we'll give you $200 a month in a pre-tax allowance to go do those things, you can do that. This is so much easier because you don't have to mess with all the compliance, all the issues, renewals, communicating benefits. These people, you actually have live, U.S.-based customer service licensed insurance agents to help your employees figure out what they need. And for those that qualify for the subsidies, they will help them go through that process and get those as well. Because quite frankly, everybody's a little bit different. Some people are going to take care of their health. Some people are not. Some people are going to be in the middle of the road. Some people want to buy health insurance and others are not. And I, for one, quite frankly, am tired of being responsible for providing health for my employees and trying to make sure they have a healthy lifestyle. This allows me to do what I can and let them make the choice. I don't have to worry about it. And the employees get what they want. So instead of me picking a couple of plans and they either opting in or out, now they have numbers of options to choose from. So we think it's a win-win for the employees and a win-win for the employers, and it is much simpler. Now, I've lost track of time. All right, we're coming up on 30 minutes, so I will take a couple of questions. Again, this is being recorded. You can send an email to me, give me a call. Whoops, don't call the number on the truck. That's a bogus number, but it looks good on there. So this is the information. You can email me with questions, or give me a call, or whoever gave you this information, you can get with them to get more information. I got a couple of questions here. I'll answer this one. Bill wants to know, should everybody drop their group plan? Well, no. It's still each client, each company is different. If you have, highly compensated individuals and no one's going to qualify for subsidies and you're a older group, it may actually be better for you to stay with a group plan because of the way the law is and the compression of rates. And so it is possible. Again, you just have to crunch the numbers, and at the end of the day, it's what's the best thing for your company, what's the best thing for your employees. That's what one needs to look at. Another question, do you think they'll push back the individual mandate? No, that's not going to happen. It's going to happen. The exchanges are up. They're going to be going by October the 1st. So everything's a go other than the 1-year delay for the penalty for the companies that have more than 50 full-time employees that are not able to provide health insurance. Another question, what about if you have more than 50 employees? Well, again, you'll just have to crunch the numbers, but I think 9 times out of 10, if you have to pay the $2,000 fine, which nobody wants to do, and it's not tax deductible, and I get that, and why should you have to do that? But I think a lot of companies will find that it's cheaper to pay the $2,000, gross up the employee's salary or give them a health care reimbursement situation and just let them go get money from the exchanges, because you see how much money the government's going to contribute, and individual private corporations just can't compete with that. But it'll be up to each individual company. It just needs to be an option to look at. Well, I have run out of time. I want to keep this no longer than this. Feel free to call me. Again, this is recorded. We'll have it posted where you can listen to it again, and have a great day, and we'll look forward to visiting with you again soon.